All right, everyone. So I want to start off the call today with really dropping in. I know that this is a wild and crazy, somewhat messy, and I believe ultimately beautiful time for all of us on the planet, and especially for parents. I think it's probably safe to say that we are all feeling a range of emotions. Maybe some of you here today are financially overwhelmed. Maybe some of you here today are having a really, really difficult time with balancing and juggling how to educate your kids when they're at home right now. Maybe some of you are feeling the stress and strain of not knowing what's going to happen with your employment, or with your career path. And maybe there's others of you that are not exactly getting along, with their spouse or their co-parent or with their kids. And then also maybe there's parents on here who are having an exceptional time, right now, and just very, very grateful that they are able to be at home more with their kids and with their significant other. So no matter where you are on that spectrum, I want you to all really acknowledge yourself for being brave, for doing the work, and for prioritizing getting on this free call today so that you can continue to evolve and to grow yourself. So if you will, for all the people over on Facebook and here on Zoom, make an affirmation to yourself right now and to everyone else on the call, and just type in the chat box or in the comments, I am in the right place. So let's do this. Let's affirm this. Give yourself that message. Give everyone else around you that message so that you can set the intention of really getting something out of this call today. Okay, so a reminder for everyone, my name is Renee Aria. I am a co-founder of Little Humans with Mindvalley. My husband Akira and Vishen and I founded Mindvalley actually last year, and at that time started filming with experts and masters around the world in parenting because we saw a blaring gap in parenting education. There was essentially no good information that I could find that actually merged personal development with parenting. So that's the beautiful marriage of what has happened and why we have created Little Humans. Also, we have had many, many people ask us about the replays of these calls. People are getting a lot out of the calls, a lot of value, a lot of interaction with the other people on the calls, and loving all of our experts. So here's the deal. The replays are available for 24 hours on the Mindvalley Facebook page. The way that you can actually be able to own the collection of these live calls forever, because of course this is a 4-week series, Monday, Wednesday, and Friday. However, we know that you're not going to be able likely to jump on all of the calls, but you will have indefinite ability to replay all of them if you actually join us in the Little Humans collection, which is on a super deep discount right now to match these times, but more on that later. Okay, so here we go. Dr. Edmond Sarraf, without further ado, I would just like to share some personal things about you. As I mentioned, Dr. Ed is our pediatrician for our son, Osiris. We feel so blessed that we were able to meet him when we were living in Los Angeles and to experience his magic firsthand. Some of the things that you won't be able to know on this call is exactly how incredible he is with children. I'm telling you, my son goes into his office and does not want to leave his office. So he definitely has a lot of magic when it comes to working with children. I'm a first-time mom. Hi.
Hi.
Oh, hi.
Sorry to leave you hanging.
This is my son, Osiris.
Hey, everyone who's joining.
Oh, yeah? You want to say hi to the people? Water.
Yeah, we're doing projects
downstairs. Do you remember
downstairs.
Who this is? Do you remember Dr. Ed? Dr. Ed. Oh, he wants to hold the vitamins. Okay, my son loves vitamins, by the way.
Oh, yeah.
Cords.
Okay, we'll take it.
Okay.
Here, let's go get it.
You say bye, people. Bye to the people. Hold the cord.
He's interested in all the equipment we have set up here. We'll let you get back to it.
Okay, say bye-bye, Dr. Ed.
Okay. Say bye.
Bye, buddy.
Bye,
love you.
Have a great call. Thanks, everyone, for joining us. I'm going to be taking care of him.
Go play.
Yeah, you might have to come up later to help me with technical things, perhaps. Okay, so where was I? Yeah, so with Dr. Ed, my son always remembers him, and my son loves vitamins, and in fact will say whenever he takes a vitamin, Dr. Ed vitamin. So for me, it was a no-brainer when we were creating the Little Humans collection that we really, really wanted Dr. Ed to be a part of this, and he is going to be happy to answer any of your questions later in the call. So for those of you on Zoom, if you just navigate at the bottom of the screen, you will see a Q&A box. Please put your questions in for Dr. Ed into the Q&A box. We will get to those towards the last half of the call. So Dr. Ed, here's a couple other things about you, just so people can know some of the formalities. You're the founder of the Southern California Integrative Wellness Center, which is one of the premier integrative health centers in Los Angeles. Dr. Ed is a homeopathic pediatrician who believes in using natural treatments such as food, nutrition, herbs, and mindfulness as the primary treatment for patients. And he has been in practice for 19 years. Okay, so we have a real pro that is on the call with us right now. And Dr. Ed, can you just please maybe give us a little background and history on what exactly started your path in integrative medicine? Because 19 years ago, you know, that, am I just making up or assuming that that probably wasn't a super popular path 19 years ago?
Yeah. Hi, Renee.
Hi.
Hi, Kira. I love you guys. Yeah, 19 years ago, even for myself, when I, graduated from Akron Children's Hospital, that's where I did residency. It was not even on my radar for myself. It's not something we're taught. We're taught how to, diagnose something, prescribe medications. So I got my medical training at a wonderful, beautiful children's hospital in Akron Children's. And I'm very grateful for that because medicine has a role and it's very important and it can save lives and it can really make a difference. But, my journey after a residency took me to Bakersfield. And, I was there for 2 or 3 years. And even then I had the medication mindset. And if you know about anything about Bakersfield, it's a valley. It's, everything sort of gets stuck and you have a lot of farming. So you have you can see the plains essentially drop all the pesticides and herbicides as you're driving through. It's an oil city, so you have all this heavy metal in the environment. And what happened to me is what I saw with the kids all the time. They had asthma, allergies, lots of autoimmune disease, and the most number of cancers I've ever seen in anywhere. But we had all this chronicity, and my body changed. I became asthmatic, it really flared up. Allergies were terrible. I was on Advir, I was on Singular, I was on Zyrtec, the stuff that we give to everybody if they're not controlled. So constantly I was giving this medication and I saw that my whole role was to prevent, to suppress something. So after that, after a few years, I'm like, there must be something more. I came and opened my practice in Beverly Hills and LA area. And my first journey took me to the CEDH, which is the Center for Education and Development of Homeopathy. And that's where I changed my direction. As soon as you start giving some remedies to a 1-year-old who doesn't even know what's inside their bottle, they can't sleep, then they start sleeping, or they can't eat, then they start eating, and then the parents, finish the bottle, and then the kid has the same problem, and then they get another bottle, they start putting it in. For me, that was my aha moment. It doesn't make a lot of sense to a traditional medical doctor or osteopath if you think that way. But once you experience it, and I saw all these different miracles, it truly changed the direction of my practice. And then the next step was the Institute of Functional Medicine, which I truly admire and love. And everybody should go to their website and sort of understand, what it is. It encompasses everything. The nutrition, first it wants to go to the cause of disease. So there's a lot. If you have a lot of chronic conditions, there are a lot of different types of tests in order to try to figure out why. And then it uses everything. It starts using nutraceuticals, pharmaceuticals, herbs, enzymes, Chinese medicine, and then the other aspect, which is the mind-body approach. So that changed my practice. And I went from a pill for an ill approach, which is typically the allopathic model, into mind, body, soul. And ever since then, I can't tell you how happy I am, because I really, truly noticed a difference. In Bakersfield, for example, I did maybe 10 or 15 antibiotics a day, seeing 40 kids a day, and this constant one, come through and out, and green boogers you have to treat with antibiotics. And now I have so many different tools, and maybe I do 15, 20 a month, between two practitioners. I have a naturopathic doctor, Dr. Molly, here too. So it's really changed, the way I, live myself, and of course my families as well.
Yeah, absolutely. Well, I see it as someone who has experienced, the byproduct of this type of medicine. I just feel extraordinarily empowered. As I was sharing before my son came in, I'm a later in life mom. I actually have not really been raised around children at all. I'm now almost 46. So I lived so much of my life without children, and I don't have family, out in California where I'm living. So I just really didn't have a lot of exposure to kids. And quite frankly, a part of me felt a little bit scared, around just like the physical caregiving aspect, and am I going to be capable, of fully keeping a child safe? And, what are all the things that I need to know? Like, it can get, really quite bombarding. But I always feel like being in your presence and the way that you holistically approach health, you just have so many tips and tools and wisdom that really makes a person not only feel empowered, like they're in the doctor's office on the front lines, but in the whole range of life. And, I think that that's one reason why my kid loves supplements, which we will get to answering that question later, because Michelle, I see that you have that question in the Q&A. I'm actually going to put that in the Q&A box. So Dr. Ed, I think this is a really big thing to address today, is this topic around facts, not fear. And I really want to know exactly what that means to you, because I can only guess that you are having a lot of people ask you a lot of questions right now, especially about what's going on in the world with our, quarantine time, with infectious diseases. So just share with us your viewpoint on facts, not fears.
Sure. So, you touched it on the basis, just even for yourself being a first-time mom, there's so much uncertainty and it creates so much fear, right? Just so basic stuff, without even all the things we're, experiencing in the environment right now. So my role, I feel I have certain roles as a pediatrician, and, and one of them is to give informed consent. And when I do informed consent, I want everyone to know pros and cons of everything. And we'll get into,
What exactly does that mean, informed consent?
Informed consent is whatever you do, whatever, anything you put in the body, anything you put on the body, the way that you possibly can think, everything has a pro and a con. So what we want to do, what I want to do most, is really make sure that people see both sides, so they can make a decision based on their values and their goals and how they want to raise their children. So that becomes very important. The second thing is that I want people to have perspective on, how they live their life. So again, as a first-time parent, there's so many infections, and we're going to talk about some of them today. I think that it's important for people to understand, when you're at home with the child and you haven't seen certain things, as soon as they get a fever, you sometimes feel the worst. So one is to understand, what are fevers, what physiologically, what are they good for? Or should we suppress it all the time with Tylenol or ibuprofen or not? And when we see a lot of numbers, it allows us to get an idea which direction a child is going. So my role as a doctor is to give some perspective. And then I want my families to know that they have power. They have power to do different things, to change certain things. And the reason I'm a pediatrician, what I love about it, is that if you gain some perspective on one little thing and you're oh my God, I can't do this, I'm gonna be a terrible mom, or I can't breastfeed, or there's so many different thoughts that come into the head. As soon as you make one tiny change, one iota of a change, and that can have a completely different destiny for that child. So if you make a circle and you make one tiny change, good or bad, either way, you end up in a different destiny. But the sooner you start, the bigger change that at the end of your life that becomes. So I want families, everyone, to know that they have power. And lastly, I like to give my families choices and resources so that they're not stuck. We are, at this moment in time, we're just so limited, especially I think in allopathic or general medicine. There's only so many drugs we can give. So I really want my families to know how different things work and how you can add to your body so that you're not just dealing with illness, but you're also preventing stuff. And you can treat different things as well. So to decrease fear, you need all of those components, and I'm a big Tony Robbins fan. I love the guy. And one of the first things he does in Unleash Your Power Within is says, we don't make choices, and we don't do a lot of things in our lives because of fear, and fear stops us. And it's so true. As I went to all these different seminars, you just notice that. And part of it is internal. And, there's three things almost everybody says to themselves. And I really want people to think about it, that I'm not good enough. There's something wrong with me.
Yes.
And I may not be loved, or I'm not lovable. And all your kids will go through that from an early age. From 5 and up, you got to start looking to the teenage year. Everybody goes through that. And, if you notice, if you're not noticing, you may go decades in your life before you start working on these things. So again, part of the role of decreasing fear is to recognize these things that our kids have early so that you can make a big difference in their life. And right now, and then there's the environmental problem. So you have different families and friends that can give problems. You have what we have right now, which is an infectious disease that, so media plays a big role, because I can just see somebody in some country or some state that doesn't have access, they're stuck at home, and all they're watching is, the death and mayhem, because that's pretty much what's being reported. And of course that creates a lot of fear, and it's terrible, because one, you can have PTSD associated with that, right? Yes. And later on when we talk about it, what I fear most, is, when you feel desperate, or you feel like there's no end, or if you can't put things in context, I really truly fear about the suicides that come after. If you start losing your livelihood. So my heart breaks, with what's happening in our society right now, and all the livelihoods, that people are losing, and all the difficulties of trying to put things together if you lose your job, and how to make ends meet. And of course, all the lives, even one life is too many. Yes. And that's it's very, very difficult, to deal with loss. So that's very important. And we haven't seen something like this in any of our lifetimes, right? Right. It was 1918 when we had the last pandemic, something similar to this. Of course, that was different, and this is very important, because I want to make sure people understand that flu killed 50 million people. And this will be, if everyone's responsible, and I pray to God, and I really want to emphasize this, people have to take this seriously, and they need social distancing, and they must, must do social distancing, and if everyone did their role, and that's part of it, again, we have to work as a community, then this will go away much faster. So please take it seriously. Don't, but also take the opportunity, and maybe we'll get, a discussion of that, in order to what we can do in order to help with that. So the fact versus fear, this, fear has a lot of components, and this is the opportunity for us to work on that, when we're stuck at home, with family, and really, and hopefully make a difference.
Yeah, absolutely. Dr. Ed, I just want to chime in with some of the comments here. We're having some people say, I love Dr. Ed. Thank you so much for your time. And someone has the question, I'm not good enough. I'm not lovable. And what was the middle one that you said from Tony Robbins?
I'm not going to be loved.
I'm not loved, or I'm not going to be. Oh, wait. Oh, that's what she said, that I'm not good enough.
There's something wrong with me.
There's something wrong with me.
Yeah.
Yeah.
And well, I'm not good enough is the earliest, then there's something wrong with me. And then the teenage years, I may not be loved. And those are it's like almost the order that most people go through sometime in their life.
Honestly, you are so unlike many medical professionals that I've worked with. Some people on the call, know about this, and I'll only go like very briefly, but I had massive brain surgery in 2004. And I've actually had 3 near-death experiences. So I have spent a lot of time, in and out of the medical establishment. And I'm definitely not a person who does not believe in Western medicine. I wouldn't be alive if I didn't have the tumor removed that was in my brain. I could have actually very easily died from it. And when I was going through that journey, it was very, very emotionally and spiritually challenging for me because I actually had no symptoms of a brain tumor at all. All I knew was that there was something really wrong with me. So I was actually going into doctors trying to get diagnosed and trying to figure out what was going on. And I have to be honest, your demeanor and bedside manner is so refreshing and quite different from the majority of what I personally experienced. So I'm just so happy that you're in the world, and I want more of you in the world. And obviously on this call, we're only going to be able to touch on, so many topics with the infectious diseases and with some of the other wisdom that you're going to share. But I wonder if we can just pop into the chat box right now, perhaps what your website is, so that at least people can start walking into the door of your education, online for the things that we're not going to be able to get to on the call today.
Sure. The website is SoCal Integrative Wellness Center.
SoCal Integrative Wellness Center.
Yes.
Okay, great.
And it was.
So we'll have perhaps our admin person can put that in there. And then obviously we will make notes, afterwards as well, because I just think it's so important for people to have that bridge of connection to you so that they can even start formulating more empowering belief systems about their own wellness and their own health care, and of course, in relation to their children as well. So let's just get into the nitty-gritty about infectious diseases, which I know even coming out of my mouth, that can sound like a really scary thing. But this is, the reality. Listen, almost all of us probably when we were younger had chicken pox. Many people on the call probably had measles. I know that I had croup. When I was younger. I know that I've had ear infection, bronchitis. I mean, it's like the full shebang, that we can pick up as being humans. And to some degree, we're petri dishes. So please tell me, your insights around the most common infectious diseases for children and just how we can empower ourselves to notice them and also to how to be able to treat them.
Okay, great. So I'm going to talk about stuff that we see all the time, so you're aware. I'm pretty sure if you have children or you're planning to, these are things that you will most likely see. So number one, I'm going to start with RSV, respiratory syncytial virus. These are, again, you may have already seen it or not, and some of you people can comment on that. So RSV is the most common virus in childhood, for young kids. So under the age of 5, and it affects the younger ones the most. So under 2 and under 6 months old, you have the most amount of complications. What does it do? The number one thing that you see is that it causes them to be very, very congested. So if you have a brand newborn and they get respiratory syncytial virus, which is easy to catch, they get really clogged up. They don't know they can't breastfeed very well. So if they can't breastfeed well, they may get dehydrated. If they get dehydrated, then they may need IV fluids. So the younger you are, the more more important to unclog that nose, because they're obligated nose breathers. They'll only breathe through their nose. They need your help more than anything. That's why we want to be very careful with the young ones. It causes kids to wheeze. So that's one of the first things that you notice. Wheezing is a high-pitched sound that you usually hear at exhalation. So when you exhale, the air gets trapped, so it's hard to get out. Most asthmatics know that, and I have asthma. Big thank you, Bakersfield, because of that. We were talking about it before. So if you get tight, you can't breathe, so they have some difficulty breathing. And then if it gets really bad, then their oxygen can go down. So the main thing for little babies is they can't feed, lots and lots of boogers, then they go into the chest. So it becomes the number one lower respiratory tract disease, in children. In Western medicine, the question is, what do you do overall? So there's medication. The medication approach, we're noticing with more and more studies that it may not be helpful. Although I've seen that, for some kids, it really clears them up. If they're wheezing and having difficulty breathing, then, sometimes when you give them albuterol, some kids, will improve a lot. So again, we're not all the same. So, because we're not all the same, even though the studies show that overall it may not be beneficial, there's several kids that you absolutely see a massive change. So from a medication standpoint, I usually, try that if they're having any difficulty. And then there's a whole bunch of remedies that I don't know if you want me to do the remedies at the end, or if you want me to do the remedies or treatment.
I think it's great to go into, I think it's great to go into the remedies as you're actually talking about the ailment. Now, I want to ask, this is probably just such an amateur question, but it's coming up for me. Is this something that would naturally go away on its own, or it's like, this is a life and death situation, and this is when you definitely need to go into the doctor, non-negotiable? Because I think a lot of parents have even trouble walking that tightrope of, do we just wait this out at home, or do we go into a doctor? Do you have any guidance around that?
Sure, of course. So it really depends on the age and the child and how they're handling it. If it's just nasal congestion and the parents can suction it out, because again, that's what you pretty much do with traditional medicine, and the kids are feeding and they're not having respiratory distress, you don't need to go. If they're having now retractions and they're pushing in and out there, you can see the ribs going up and down. You definitely want to get attention. And if they're getting dehydrated, so if their mouth is getting dry and they're not peeing as much, especially for the little ones. As you get older, you get a little bit more and more listless. So that's when you want to get attention. It's very easy to diagnose. There's a simple swab we do in the nose, which is what we don't have for COVID that much, right? We'll get there later. But there's a little swab. Within 15 minutes, we know they're positive or negative. And the reason I actually use that is because there is this epigenetic kind of association that if you get RSV, there's a higher likelihood that you will get asthma as a child, especially if you have family history of sensitive people. So I think it's worthwhile testing just because of that. Then you see more and more that if the kids catch a cold and they get asthma or symptoms like that, you say, okay, well, that's the reason most likely that your asthma got triggered, is because of this bug. Go ahead.
Yeah, I see. No, this is great. I love these distinctions. Sini actually had a question here. Do I have to worry that this would go into a chronic situation? So I think that you just addressed that. Now, if it's diagnosed in time and it's treated in time, is there less of a likelihood that something like asthma or something else might develop later? Or is it?
So that's where your genetics may come in, and then it's how you do, how you live your life and how you decrease your toxic load. That will be, be important in terms of how your child does overall. So we're all going to catch colds. Coronavirus causes a lot of different, ailments, including Croup. We'll touch on that in a second. And that's okay, because we need our immune system to be activated. But if it's overly activated, that's where you cause the problem. So asthma is an overactivation of the immune system. It's a hyperactive, and Sometimes bugs do that. Sometimes it's chemicals. Sometimes it's radiation and EMF, and sometimes there's some gut. You don't have good gut flora, so that can create that. So having said that, you don't have to worry about it. What you do is you inform yourself, and then you have a plan of action. And we'll go into some remedies and stuff like that and different things in order to sort of help decrease that risk factor. But it is very common, and chances are, if the kids are in daycare or in preschool, if one gets sick, pretty much everybody gets sick, as you're noticing with our current pandemic. those things are, yeah.
Absolutely. I think you made a really empowering statement there, that inform yourself instead of worrying yourself, because usually if you inform yourself, you're going to take action based on that information. And I notice that oftentimes when I'm worrying, when I see other people worrying, it's worrying because of not taking action. So I love that, just the simple act of informing yourself and then deciding what action you're going to take can really kind of cut down on the stress spiral that can happen for parents, particularly whenever we're thinking about our kids, because God, we know that we want to protect those children, like with our own lives. It's so hard to detangle, from the stress when you see your babies, and your kids not feeling well. Okay, thank you. So let's move on to the second one. And I really appreciate this news about the RSV, because I personally had never even heard of it before. So this is super educational for me. Please, those of you on the call in the chat box, just drop if this is informative for you right now in the comments.
And that is your number one cause of hospitalization for young children. So I have a little bit of statistics here, just so in the United States, where in a 10-year study under the age of 5, there was 670 or 6.7 over on 1,000, or 670 in 100,000 in population. If you want to compare it to the flu, for example, in a few minutes, that required hospitalization. So, again, there's other things we can do, and most of those kids survive, but I just want to make sure that people understand that there are a lot of bugs out there right now that create a lot more hospitalization than we're aware of. It's not just current. That's why I want, COVID to be in a perspective, right? As we give facts, some of these can become scary for some people, but it can also be a comparison as well, so that, you can say, okay, well, this is what's happening now. And the nice thing with with COVID is that the death rate is much, much lower than pretty much all of them, for especially young children. So as I was just getting prepared for this, I was very, very surprised to notice we didn't even test adults for RSV, but globally, in Asia, RSV was the most common pathogen from under 5-year-olds, and about 35% of cases with severe pneumonia in Africa and Asia. I was shocked to see that number. Of course, you can understand there's certain areas where you don't have good nutrition, you're emaciated, and you have a lot more chronic conditions. So when it comes to all of these things, it's important that we take care of ourselves, in order to have a better outcome. So that will become very important in the prevention. And then adults, this was a shock to me, because we don't even test kids, 5 and up. But adults, RSV is an important cause of unrecognized lower respiratory tract. And in different observational studies, it has up to 5 to 8% mortality rate. So they don't, So these are some things I think that we should even test more as our immune system gets weaker as we get a little older. So, that's a little bit of RSV. We'll get into remedies. I guess I'll do that at the end so you guys can see in general the idea. The next most common thing we notice is very close to RSV in terms of number, is something we call Croup. So Croup is another, usually virus, the majority of the time. The most common virus is para-influenza. So not influenza, para-influenza, and there's 4 subtypes. And it causes what you will notice as a bark cough. So now it's here around the neck. It causes some swelling. So when, so when the kids, because there's swelling here, when they cough, it sounds like a dog or a seal, and then because it's here and it's swollen, when you breathe in, you have a problem. So whereas asthma and RSV, when you breathe out, you have a problem. Croup, when you breathe in and you get this, that kind of sound. So stridor, that's called stridor. A lot of people confuse it. I get all these texts from my families, my kids wheezing, and then when I listen to it on text, like, they have stridor. Stridor is one sign of respiratory distress. So, and when does this happen? It starts with just a minimal cold, and then usually at 2 a.m, because I get these texts usually at 2. So between 12 and 3 a.m. is when the swelling happens more. So why is that? In order to rest, our own body's steroids goes down in order for us to relax. So we need to relax. We don't want all that steroid in our body. So our adrenal gland sort of calms down. And as the day starts, our steroids go up, in order to get us the energy to do our stuff and move around and do our work or go play for the little kids, right? So, so most illnesses, which you'll notice, they get worse at night, and croup is absolutely the big one. So if they have stridor, then you have to take some kind of action. The most common action everyone takes is that humidity. So they turn on they go in the bathroom and turn on the heat, and they get a massive amount of humidity, and it really helps. And boom, the kid starts feeling better. And the other thing is cold. So cold air, like my nephew, Ethan, he was 6 months old. My sister had just left our Shabbat dinner. And as she went home, he just started runny nose. And the next thing I know, she's calling me. And I can hear in the background, Ethan gasping for air, like the big stridor. So I told her to come back and, and pull the window down. So one of the things I ask my families to do is maybe go for a drive, especially if it's at night, it's a little cooler, and that air allows them the swelling to decrease. So you could see this little 6-month-old, huge, just gasping, his fear in his eyes, and then when, I got in the car, we went to UCLA at that time, as I knew he needed, the traditional medications. Thank God for traditional medications as well. He needed a steroid. And, but by the time we got to UCLA, which was maybe 10 minutes, you could see him, start breathing. He just, as we drove, his airways just opened up. And by the time we got there, it was a little fat 6-month-old, sort of happy, but we knew that, the steroid would, essentially the swelling would come back. So at that time, he got a shot of Decadron. So traditional medicine has a role, and I want to emphasize that we're not going to remove traditional medicine, but there's a lot of things we can do in the meantime. So cold weather becomes very important. And this is one of the most common causes of ER visits. About 5.6% from what I read is of children. This is one of the, that's the percentage that I got from Up to Date. And but the good thing is that it has very low mortality rate. So even though it happens a lot to kids, there's a lot of office visits, a lot of steroids essentially given. This is one of those common illnesses that you'll see.
In what age range is that approximately?
So it can happen at any age, because you have that dry croupy, you have the dry barking cough, but the younger you are, the more, the smaller your air pipes are. So this, and because, naturally they're smaller, so any extra swelling causes more distress. So, it's, I think under the age of 2 becomes the most important. That's what I see with our kids. But the chances of ER visits, again, 6 months and old, under, becomes even higher.
Okay, got it. Okay, so that's number 2. Okay. And then the third one?
So then we have flu. So let's talk about.
Yes, let's talk about that, because
right?
I know we've all, especially, is it just me or the last couple years, the flu is just everywhere and seems almost unavoidable.
You know, it's so interesting you say that. It almost feels like every year we have one of the worst flu seasons. But, you know, when I analyzed the data, it was very interesting to see that it's consistent in terms of morbidity and mortality. But I also feel, especially what I get from, you know, when I listen to media, is that this is the worst year, or this is going to be the horrible, you know, the worst of the worst. And, you know, so that is very important, you know, and I'll go over some numbers very soon. But let me tell you what this year's flu season, it was a little different. This was worse I've opened this practice for 13 years. So this was probably the worst of the 13 years that I've worked. We started with influenza B, and then we had influenza A, and, you know, still trickling in a little bit here and there, but, you know, so I mentioned that the fever curve, generally speaking, is the first 3 days are the highest when you see them come up and down, up and down. So don't be surprised if it lasts 3 days. Day number 4 should be low grade, and day number 5, most fevers are gone. That's a general rule. So what I tell my families, that if day number 4, your fevers go up more than what they were, always come and see me. If day number 5, you still have a fever, come and see me. Okay, because we want to then rule out secondary infections. As long as the kid's breathing okay and they're hydrated and they're acting okay, you can always be in, you know, touch with your pediatrician. But those are some rules I've seen over the years, and many times it follows a rule. So if, let's say, you know, you have 2 days of fever, or let's say you have day number 5, it goes back up, many times those kids have a secondary infection. So whether it's an ear infection or pneumonia or bacterial bronchitis versus viral bronchitis, that's the little art of what we need to do in order to sort of differentiate between that. So that's some good rules to have. This flu season, the fevers went up to 7-8 days. So it was longer, and we tested the kids if they, you know, if they're flu A or B, and they, you know, and again, it's a very easy swab in the nose, and we can get it within 10 minutes. Flu has a lot of body aches in general. That's very different. It's very intense, and it's usually very intense initially, which is a little different than COVID, you know, overall. So some of the differentiations between that, because you have the bad myalgias, which is the muscle pain, and of course, if you have underlying conditions, very, very important. So asthma, you know, diabetes, cancer, you know, these are, you know, again, people that have to be extra careful, because you can have a higher rate of hospitalization and a higher mortality rate if, you know, if that happens. So, you know, I'll quickly go into COVID. And would you like to quickly do that so that you guys understand? So COVID, you know, we have like, you know, 7 families that are positive. We assumed that everyone got it because their kids were sick as well. We haven't tested a lot of things because a lot of the kids, because we ran out of kits. But when everyone got sick and we were able to test some of the families, we noticed that the kids had 2 or 3 days of symptoms, and they had the mildest colds out of all of them. The parents had more flu-like symptoms. And of course, you know, and then depending on any comorbidity or not, you know, they could definitely go into the more severe. And then of course, we had one grandparent who got it, and, you know, he wasn't hospitalized. But one of my very good friends, Elliot Berlin, he's open about this. So that's why, you know, he's a chiropractor. He was in the ICU. So, and he's in his 40s. So, you know, you can, you know, as far as kids are concerned, and thank God he did well and he's recovering, but there's some scary moments there. So as far as just, you know, numbers, it's, you know, important that over here in China, there's some Chinese studies. The number one thing you want to look for COVID is pneumonia. So when it came to China, 55% of the kids that were tested and had symptoms were mild to asymptomatic. 40% had some kind of pneumonia. and then 5% were severe, and less than 1% were critical. These are children.
That's very interesting to hear that statistic around pneumonia and kids and that link. I had not heard that before.
So this was a study of 1,391 children in Wuhan, China. And then we have our study here that we have 2,572 under the age of 18. And in terms of hospitalization, 6 to 20% depending on underlying condition. Or they have either heart disease and asthma. And again, every one of the viruses that I spoke to you, with the exception of Croup, if you have asthma, many times you may be hospitalized in order to control that asthma. So it's very important to understand that that's one of the main reasons people are hospitalized. And if you take a child's x-ray with RSV, you're going to see that interstitial, coughing, whereas at the same time with COVID, you're going to see some changes on the x-ray as well. So these are usually viral pneumonias. As far as, losing kids, that we had one child under the age of 1 that had intussusception after being hospitalized for a couple of weeks. So, and maybe one other child. I think we have 2 children under the age of 9 that have, lost their lives. So it's the fatality rates where it was before, it was 0. Now there's 2 cases. And then, you have then all the other cases when it comes down to, as you get older, the chances go up slightly based on your comorbidities. And then over here you have, 0.2% in 10 to 19-year-olds, 20 to 29-year-olds, 0.2%. And these don't also take into consideration all the people who are asymptomatic.
Yeah.
Now, as I say this, I want everyone to understand one thing. Every life matters, and we're putting our parents and our grandparents at risk if we don't follow strict CDC guidelines, and if we don't be responsible for everybody. So I have a mom who has cancer and she's immune suppressed. So you have to be careful. I'm not saying this in order for people to not to be irresponsible. I'm bringing it so that we understand that even though we have some numbers of fatalities, if you also add all the people who are not counted, who haven't been tested, the numbers will be low in general as a whole. We must be responsible. I know you're going to get into questions and stuff.
Thank you so much for saying that, because that does put things into perspective. It's like, take action and abide by, the quarantining and the social distancing, but at the same time, know what the facts are so you don't freak yourself out and send yourself, into a greater stress spiral. So we're going to get into the questions with really practical guidance on how we can strengthen our immune systems through food and through vitamins with moving forward. So the question I want to start off with, because you have mentioned a lot about asthma, pneumonia, some of these underlying breathing conditions, really, particularly in children, that then kind of predispose them or set them up for more of a struggle if they happen to get one of these other viruses. So I'm asking on behalf of the parents here in the Q&A box, what can we do on a daily, weekly basis to take care of our children such that perhaps they won't develop, the symptoms of asthma, or pneumonia, and really get our system strong from the inside out?
So one thing we have to change in our society, and I pray to God, one of the good things that will come out of this is the new normal. I don't want things to go back to normal. I want things to be better always. So one thing that I pray comes out of this is that everyone who's sitting at home have time to reflect on their lives, is to say, what are we doing with our own health? So in this culture, we're a pill for ill approach. We think it's okay just to, if we get sick and we get asthma, just to take medications forever. We don't say, what is our body missing? how do we take care of ourselves? How do we prevent, illness? So, take a look at what we eat. One of the things I do with my families right now, I say, put your mask on with your kids. When they're watching cartoons and stuff like that, look at the commercials, discuss what those commercials are. You can see the cereals and all the cookies and the cakes and all that other, mumbo jumbo that is being sold to the children. And then when you go to the store, again, with your mask and everything, and be carefully when you're shopping, as you're going down the aisle, just point. Are they real food or are they processed food? Are they, refined sugar or are they whole foods? So it's an opportunity to teach and play games. If you're looking at a commercial, say that's sugar, 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 sugar. You know what I mean? So in order to train their brain, in order, not to decrease the amount. Now, I don't think anyone needs to be perfect. You can do the 80-20 rule. And I usually keep home as a mecca. So the home should be clean as can be. And then when you go to the parties and friends and stuff like that, it's an okay time to cheat. So we can't have a pill for, yeah, go ahead.
Yeah, I was going to say, what are some of your staples then that you would want to see in people's homes? What do you want to see in their pantries? What do you want to see, in their fruit and vegetable dishes at home that can really help to create a strong immune system for the kids?
Yeah. So one thing we talk about, and this is something from IFM, the Institute of Functional Medicine, that we send all our families, is the colors. This is the colored diet. These are all the different fruits and vegetables in different colors. And, and you can play lots of games. And if they're picky eaters and stuff like that, you mix it in their soups, you make the smoothies, and you become creative. So this, we are what we absorb. We're not just what we eat. And that's one thing that people think. And the soil does not have enough, of the, vitamins and minerals that our enzymes need in order to stay healthy. So this is why I use a lot of different approaches with my kids. And then you sort of choose the diet that's right for you, and you sit with your practitioner to see what's right. Whether it's a, vegan or vegetarian or pescatarian or paleo diet, obviously we want grass-fed, we want wild, we want to make sure we don't, do too much fish because of the heavy metals associated with that. So we need to learn certain rules about our diet. We want to exercise. We lose that exercise when we get older, right? So, and if you have kids, you want to be a good example, for them. And I'm totally guilty for 15 years. I let go of it, and now I'm going back into it. We must be a good example for the children. We can't, continue to not exercise and eat poorly. That's huge. We need adequate sleep, very important for our brain detox, and we need mind, body, spirit. So one of the keys to brain development that I put it, I say it in 6 different ways, but my 6th one is mindfulness. So meditation, because during the day we're constantly going out, we're giving, we're doing things for others. And what we need to do is reflect and start focusing on ourselves, and and then having that good family time. So these are the things you can sort of discuss, at home, in order to start creating good habits, in order to change past behaviors, and you'll see your body change. I did an intermittent diet for 3 months. It changed my metabolism. My wife does an amazing job doing what we talk about right now, and it's amazing. The weight comes off, the energy goes up, you think clearer. It's wonderful. And we take a lot of different supplements because I know our food supply doesn't have a lot. They're missing certain things. And if we can't do a perfect job, that's when I go into my little supplement bag.
Yeah. Thank you so much for sharing this. And this is why I love you, because you have this holistic approach. It is about the foods that you eat, but also about so many more things, as well, right? Like you're talking about the mindfulness. We do have a mindfulness and meditation expert that's going to be coming up on this live call series, Andrew Newman. I believe that he is in week 4. So tune into that, because I know a lot of parents struggle and have difficulties about where to even start getting your kids on the path of mindfulness and meditation. So a couple of things, Dr. Ed, because what you're sharing is gold. Number one, people would love to have a copy of your handout on the foods. Is there any way of being able to get that for people on the call so that they can apply some of what you're sharing around those rainbow foods? Megan has the question, I'm vegan and raising my kids on a plant-based diet. How do you recommend we supplement B12 and iron? And what are the best whole-based foods that you could recommend for them?
Yeah, so I mean, there's lots of, I do supplement everyone with, I think I have it over here with a B12 supplement. I like the methyl factors, methylated B12, methylfolate. They're in a more natural source. So this is something most of us is one of the, I think I would say the 4th most common vitamin deficiency in everybody. We have different genes that we may not absorb this very well, whether you're vegan or not. So this is one, and there's no one thing that I'm endorsing. These are different things that I use. And iron-based foods, I generally have a handout, and I give them a handout of different iron-rich foods. And then I have also different, if the kids are in their picky stage, I give them some supplements that are plant-based that are iron-rich.
Mm-hmm. Do you have, what are like the top 3 iron-rich foods that you can recommend for kids?
So, I don't have it right now in front of me, so I can't, give you that at this moment.
Sandra, we were on the same page, by the way. I just got in the chat box the exact same thing that I just said about that.
I think maybe one thing, in order to sort of, let me give you some impressions of how I treat any of these things. So you guys have some idea of different mechanisms you can use. So when it comes down to, the flu, I love my homeopathy. Oslo is extremely well known. Again, many traditional doctors don't believe it. I've seen miracles with this. I use Flu Fix is a whole bunch of different remedies for the aches and pains, and then so this is one of my favorites and go-tos. Very important for COVID as well, because some of the medications that are being given may be helping zinc absorption into the cell.
And what is, Dr. Ed, what is the brand on that one? Because I have that one and I give it to Osiris, and I think it has really helped him.
And this is premier research. I can again share these.
I'm dropping these in the chat box, everyone. So if you see me typing over here, that's what I'm doing.
So most of our immune system is in our gut. So gut health is very important. So fermented foods, of course, super, super important. There's many different types of probiotics. So I like probiotics with or without prebiotics to feed the bacteria. I usually do it at night in order to see the bacteria. How much of it is absorbed is questionable, but I see a huge difference in my patients.
Yes.
I use homeopathy. Vitamin D is very important. It's one of the most common deficiencies in our body. We're, inefficient or sub-efficient in vitamin D. Helps many different cells work more properly. And then we have vitamin C, of course, lots of studies you can look at. Vitamin C is a great antioxidant.
Now, can I ask you a question around the vitamin C? For what age do you feel that lipospheric or liposomal vitamin C is recommended?
Yeah, I start around 1 or 2, but I give very low doses. Actually with liposomal, I start around 6 months for iron absorption, but I do very small doses of that. Because, instead of giving cereal with iron, which is, it's not my first foods, of course, I give a very low dose of vitamin C. And as we talk about this, and I know you haven't brought it up, Renee, is that, again, these are just some ideas that we're giving families. This is not medical advice. I really want you to just, if you don't mind, make sure to let people know. This is great for whooping cough. It's there's some studies from different people that says that it's very effective. So homeopathy, again, there's different levels of homeopathy that works with medications or works with herbs or with other nutraceuticals. I'm a big omega fan. So omega-3 fatty acids are fish and flax oil. There's the flax and the chia seeds and stuff like that for more vegan. And then the actual fish oils that are clean, because you can't eat fish all the time because of the heavy metals. But I give this every day to most people because it's great for the brain, the eyes, and the body. Helps with constipation and
who is that issues. One by Dr. Ed?
This one's from Design for Health.
Design.
We have, yes. So that's a lot of my kids. This is one of my favorites for Croup. This is for the spasmic cough. Overall, it has lots of different remedies that when you have the barking and the spasmic cough. One of my
what
favorites
is that
for
called?
Croup.
I can't see it over here.
That's Drozeraplex, for over 1-year-olds or 2-year-olds, and then you do the pellets for the young children under 1. Okay. Something I use and I find it, and a lot of my families find it very effective. I personally love chemotherapy. There's many different types. These are embryonic herbs that help with inflammation and different things. So for kids who have inflammation, I use blackcurrant a lot. And if they have asthma, I use leafy tree a lot. There's many others.
And can you tell us, can you just educate us for a minute on exactly how those are made? Because I know that you can give those to very young children as well, right? The gem therapies.
Yeah, I usually start over 1. Again, there's not double-blind placebo studies in order to back these because we don't do those types of studies when it comes to nutraceuticals and herbs. But they're just embryonic buds that when the flower is very young, they extract the flower with alcohol, and most of these are made in France. The ones that are made from Aron, and then that's one avenue. I use them myself, when my asthma flares up, and it's been very helpful.
And what one is that for what did you say for the asthma?
Asthma, inflammation, Croup has a lot of inflammation. That's why you have the swelling. Asthma or bronchiolitis has a lot of inflammation. Mm-hmm. The flu has inflammation, and COVID will have inflammation. So these are some of the different products that I use in order to help decrease the inflammation. A few other things. This is one of my favorite. This is a Chinese medicine that has some nutraceuticals in there. It's great for the gut. This particular woman has done some studies in universities, so you can actually see that for leaky gut and for infections. Yeah. So again, over the age of 1, I start using some of this to help the immune system. So most of these illnesses, I will go. I just
put in the chat box the name of that last supplement. It's called Biocidin, and it is an absolute miracle worker. My family and I, including my 2-year-old, take that. You just use very small drops. The instructions are on there, but you can Google it in order to have it in the future. I think it is a great thing to stave off the flu or any of the other, bacterial or viral infections. It's very strong.
And then another thing that I use for asthma and inflammation or chronic cough, because Croup can give you a chronic cough for up to several weeks. So does RSV, can give you a lingering cough. I love quercetin. Quercetin is a food-based supplement.
So Dr. Ed, we're going to follow up, in some way with everyone so that they can get the list. But in the last 10 to 15 minutes of the call, I want to continue to just quickly go through some of these great questions that people are asking on here. And one of them is, it's recommended that we all wear masks when we're outside. Do you recommend that we approach wearing masks with our kids when we're just going out for a walk?
No, if you guys are, together, when you're going out on a walk, I think just being socially responsible, it doesn't hurt. And I think it's smart to wear a mask. just in case somebody bumps into you, or they can watch as an example that you're being socially responsible. But if you guys go out for a walk for yourself and you come back, wash up, I don't think you need to wear a mask at home with your children.
Okay, great. Thank you. I know that that is on a lot of people's minds right now. Okay, Sonia asks,
wear your mask outside, everybody.
Yeah. Sonia asks, what is my role as a mother during this time for kids with asthma other than social distancing and healthy diet?
Great time to sort of discuss asthma, discuss inflammation, discuss triggers. If you haven't asked that from your doctor, start asking the questions of what they are. A lot of times, a lot of the kids have now even been allergy tested. Home environment, mold, lots of, the different fabrics you buy, are they fire retardant? So you have all this chemical stuff inside your mattresses or not? So start educating yourself now in order to, how do I decrease the toxicity of the stuff that we eat, the stuff that we sleep on, and what asthma is. So great time. Honey, asthma, you can't breathe, that's constriction. The fact that you cough for so long, that's inflammation. Now, what can we do to decrease inflammation? And you can then start talking about foods that increase inflammation and foods that decrease inflammation. And then also, and then talk about the rainbow diet and say, how can we conquer it? So you go into depending on the age of that child, how can we conquer this? How can we get better so we can run without, wheezing and, so it's a great time at this moment. This is, God willing, if everyone is responsible, this will be, in 3 weeks will be much better. But most people are not listening. So this is going to drag on. And of course, it drags on. It hurts everybody, because the more this drags on, of course, our economy gets hurt. So take this opportunity to, any kind of illness or, a chronic disease that you have, say, what can we do in order to educate ourselves more? And what can we do in order to try to empower our kids so that we're not, always just doing our albuterol role and everything else?
Yeah, that is great advice. Annette asks, how can I protect my family from any dangerous effects of 5G?
Oh, that's a tough one. Yeah. I am very anti.
You can answer or not.
It's too hard to answer right now. Yeah. I mean, listen, there are some different apparatuses that that tries to protect. I don't have it in my own home yet, so I know one of my patients just bought something. I have some things that help with radiation on my cell phones, and then decrease the Wi-Fi, of course, but. I think the most important thing is to, educate yourself on 5G, because we don't have studies, and there's more and more studies that it possibly can be harmful. As you educate yourself, then speak up. Anything, we are the people. We have the power to make change. Change happens when people discuss things together. So please take the time to share different resources that you have. This is really not a 5G talk, but it's still important with everything we're talking about.
Yeah, I absolutely agree.
Share information. We are in this together. Yeah, the thing that's really, in my heart is that, this virus, as you can see, doesn't care where you live, what country you live in, what religion you are, what gender you are. It does not care. This is an opportunity for us to start challenging our own biases. And how we treat ourselves and how we treat others. Because if we start working together as a nation, and with different countries and stop alienating each other as much, we really can take this opportunity in making this world a much better place, not only for ourselves, but for our environment. We're going to be living in this, and we keep kicking the can down the road for our kids, and that this environment is being destroyed. We need to make a change. This is why I call this a new normal. Yeah, that is a really good point. Empower ourselves now, while we might have some time and space in order to move forward. I think Dr. Ed just accidentally maybe signed off. And so if he pops back on here, then
we will bring him back on and continue, but we're all already getting towards the end of the call right now. I just want to really thank everyone for your patience today through some of the technical difficulties with Facebook and also with the Zoom connection. I really am greatly inspired by the fact that everyone has stayed on to learn this incredible information today with Dr. Ed. And I'm sure that you can all see why I love bringing my son to him as a pediatrician, and he has so much good wisdom to share with you through his social media channels. And I think that we were able to repost a lot of the notes that I took earlier on the supplementation. So maybe scroll back through the chat box if you happen to miss the notes that I had made. Also, you guys, Dr. Ed did an incredible bonus segment in the Little Humans collection. And I don't know if you remember at the beginning of the call, I was talking about the Little Humans collection, which is the program that was created through Mindvalley. My husband and I, again, are co-founders and also hosts of all of the Little Humans episodes. But Dr. Ed is in one of the bonus episodes, and he goes really deep into informed family choices, how to be your own best healthcare advocate, not only on behalf of your children, but also on behalf of yourself, because that is such a pain point, for people not really knowing how to communicate their needs, properly to their health physician. So he goes into that. And then he also goes more deeply into the mind, body, and spirit health through natural medicine. Hi, Dr. Ed. I was just telling them about your bonus episode that you did on the Little Humans collection, and that for a lot of people who want to go deeper with you, and especially on the topics of mind, body, spirit, health, nutrition, that a lot of that information is available through the Little Humans collection. So I'll wrap up with that in a second here, but let me just wrap up with you, Dr. Ed, because there was one last question that I wanted to ask from... Let me round back up here. I might not be able to, okay. Sazabin wants to know, they have a 10-month-old baby, and she feels like maybe she's not getting all the nutrients that she needs. She's only on breastfeeding. She's not really eating that much. Do you have any recommendations for her on supplementing or foods for a 10-month-old?
Yeah, most kids after 6 months need some nutrients, different than breast milk. Of course, some breast milks are absolutely super amazing. I don't know exactly why your 10-month-old doesn't like to eat. That's something you need to sort of discuss. There's something called food aversion. But, again, I do a combination of, fruits and vegetables of different colors. And then I also talk about the Western price diet. And I marry them. So, and I say, play around with the spices, because in 9-month or 10-month-old, they have some textures. You can spice things. You can change the texture. You can change the temperature. You can change color. So you want to make it appealing for a child. I put music on that feels good. So I want to neuroassociate something positive with that. So one of the things that we get so stressed out ourselves that sometimes the kids feel it. So if you can try to get your mood elevated yourself and then start playing with different things. If your child completely avoids everything and just spits it out, then you want to talk to your pediatrician about something called food aversion.
Okay.
And then if you don't mind, I just want to show one thing. This is super important. Please. I wanted to tie a lot of these things. If I'm going to put this on Instagram and the website. These are the different causes of death. And what you'll notice is that pneumonia and infection are not in the top 5 for pretty much any of these. And what you'll also notice is that other than injuries, suicide and homicide are the huge numbers of death in older children and young adults. And then you have neoplasms, and homicide, suicide still comes in the children. And the numbers are staggering. If you look at suicide, we're looking at, between 15 and 24, it's 5,491. whereas, chronic respiratory disease is 202. So we're looking at, 5,500 versus 200. And most of our society ignores that. If we want to save lives, I really want everyone to sort of understand you got to work on that mind. Yeah. Start early, with this mind-body approach, because you'll save a massive amount of lives by focusing on this. And, of course, everything we're dealing with is super important, but we can't ignore, if we're worried about numbers, we can't ignore these, because it's what is really killing young kids, older kids, and, adults.
Yeah,
Sorry,
absolutely. No, I love that you brought that up, because we're offering these calls to keep it real and to give parents the wisdom and the information that they need in order to make a change. And, of course, we want to be living in a world where it's not even that we need to talk about, the anxiety and the depression and the suicides, and that is something, that is happening now. We do have Renee Jane, who is an absolutely wonderful woman. Her practice is actually all around anxiety, and she is going to be a guest, I believe, next Friday on the live calls. So she's going to be talking about anxiety, particularly with teens. And then we have another guest expert coming up, Ria Lala, who is going to be talking about emotional intelligence and techniques to really get in touch, techniques to really get in touch with teaching your kids how to know what they feel and how to share what they feel. And this, I personally believe that the younger that we can get our kids tapping in and tuning into how they feel and being able to communicate it in a healthy way, it just sets them up, for a lifetime of health and better communication. I'm sorry, guys. I think all my talking from this week on the 3 calls is catching up with me, but I actually feel very healthy. So thank you, Dr. Ed, for everything that you have shared today. Again, I want to actually take you guys. I want to see if I can do this, because someone here on the panel, I'm sorry, but the message has now gone up in the scroll, was asking again about how to have access to the calls that we're doing right now, because they will be only posted on Facebook for the next 24 hours. So I want to see if I can pull this off. I'm going to be so proud of, I did it. Oh my gosh. Can you guys see the screen? So this is inside of the Little Humans collection. And yes, to the couple people on the chat box who was asking, will the new information from all of these live calls also be available in the Little Humans collection? Yes. This is the way that you can have lifetime access to all of the 12 90-minute live Q&A calls that we're going to be doing over the next month, which in and of itself is just extraordinary. And beyond that, you get to learn about the 6 pillars of transformational parenting. And this is really where we get into the marriage of the personal development and parenting coming together hand in hand. These are the premises that have led us to curating all of the experts that you are seeing on the live calls, and also the experts who deliver such incredible wisdom in the 15 episodes that you also get access to on the Little Humans collection. So to put it into perspective, you're getting about 45 hours of absolutely invaluable parenting education, all the way 0 to 18. We talk about very deep topics and subjects, and just all the things that you want to know about learning, about raising a happy, healthy family, about having better relationships. You will find all of that in the Little Humans collection. So again, we have all the 6 pillars of transformation and these incredibly lovely authors, some of them of which you will see on the live calls. But if you guys want to go to littlehumans.com/special, this is where you can see everything that I'm looking at. And for right now, we have drastically dropped the enrollment to be able to join us. It's actually under $200 for the 45 hours of, to me, I feel like these episodes in the Little Humans collection, it's like sitting down at a mastermind table with the person that you most want to learn from. These are very kind of masterclass style trainings, and they have changed my husband and I's life, really, truly. So Dr. Ed, you have changed, our life and our relationship with our son. It is possible for our children to actually have interest in their own health from a young age. My 2-year-old is a testament to this. He loves eating healthy. He loves taking his vitamins. I'm not going to say that at some point, maybe it won't change because, kids have their own personalities for sure. But I really, really believe in everything that you're sharing, Dr. Ed. So again, people can scroll up in the chat box, but just remind us really quickly on how they can find you on Instagram.
Yeah, I'm so new to this stuff. I'll tell you, Instagram is at dr.edholistic.
Okay.
And YouTube is Edmond Sarraf. And I promised my patients that I would do more of these and put information out starting this year. So I'll put a lot of this stuff in a little bit better so that your audience can hear.
Lovely. And, do visit his Instagram page because he's going to have his staff put up some of the different graphs and charts that we have talked about on the call today. So I look so forward to seeing everyone on Monday's call because guess what? We're going to be talking about homework. And so many of you have been leaving questions and comments around homework, especially in the times that we're in right now at home. It's like the whole thing, is homework, but Debbie Gottfried is absolutely incredible. So she is going to be covering homework on Monday. Again, the call time is 10 a.m. Pacific Standard Time, 1 p.m. Eastern Standard Time. For those of you who are interested in joining our founding family members at the Little Humans Collection, please go to littlehumans.com/special. And thank you so much, everyone, for being here with us. And thank you, Dr. Ed. Oh, and here's Osiris. You want to say bye to the people?
Hey, buddy.
Bye.
Bye.
Can you say the new normal, buddy? Can you say the new normal?
He wants to be with mamas.
Opportunity. Change the world.
He has a Band-Aid on, he says. Bye, everyone.
Bye, guys.
Thank
Bye.
you.